Hi, Joe Scott, President and CEO of Jersey City Medical Center. We're here at the Medical Center show, and today I am really excited to have one of our brand new doctors at the Medical Center, Dr. Asha Shah. Dr. Shah is a new urologist who's joined our staff, and we're really excited to have her. It was one of the areas that we wanted to expand services at the Medical Center, and we'll be back in a couple minutes to talk to Dr. Shah and about her new practice.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want.
Hi, Joe Scott again. We're here with Dr. Asha Shah, one of our brand new urologists who has just joined the staff of Jersey City Medical Center. We're so thrilled to have you. It's one of the services that we're really trying to expand at the Medical Center. Tell us a little about yourself and how you ended up in Jersey City.
Well, I am born and raised in Ohio.
Right.
And I did all of my training there. So I went to Northeast Ohio Medical University for medical school, and then I went to Ohio State University for...
Uh-oh, you're a Buckeye.
I'm a Buckeye.
Listen, I'm a Gator fan, so, you know, we might have a little competition here.
And so Ohio State University for my residency. And then I was in a private practice for 2 years in Ohio, in central southwest Ohio. And then I got engaged, and so it brought me to the East Coast.
Oh, great.
And that's how I ended up in Jersey City.
Okay.
And at Jersey City Medical Center.
Great. So, first of all, I mean, everybody, you're a brand new addition to the Medical Center. So great to have, you know, someone who just came out of training and really the ability to work at our hospital. Tell me about some of your vision for what you think we can do at the Medical Center with urology.
Yeah, I think there's lots of potential at the Medical Center to expand urology. A lot of avenues. A couple that we've been talking about are robotic surgery.
Right.
That's a big one, to bring a robot, the newest technology that is used quite a bit in urologic surgery as well as gynecologic surgery, but it's also expanding to other fields.
Right.
And is part of the newest and latest technology in surgery. And so that's one aspect, minimally invasive.
Right.
The other aspect is bringing a women's center, or women's health, focusing on women's health at Jersey City Medical Center, doing not just urologic care for women, but just encompassing overall, you know, well-rounded program.
Urology program?
Yeah.
So you talked about minimally invasive. People may not know what that means. So 10 years ago, 20 years ago, all the surgeons used to cut everybody open all the time, right? That's how they did their surgery. And now this new minimally invasive thing is out there. Tell us a little bit about that. How does it work? What are some of the benefits of minimally invasive surgery?
So basically, minimally invasive surgery is doing the same operations that we used to do through a smaller incision. And some of the benefits of doing that are quicker recovery, possibly less blood loss, a shorter time, hospital length of stay.
Right.
All of those are benefits. Less pain for the patients.
Right. So literally, before you make an incision and go in and do that surgery, but now you're just using a small tube to go in and...
Correct. So we make a very small incision and use something called a trocar, which is a tube or a port that goes in through that incision. We may use multiple ports. and then use special instruments that go through those ports and perform the surgery that way.
So how can you see through that port? I mean, how can you see what you're doing?
We use a camera, a scope, and there's all different degrees of the camera that can show us inside, and then and that's how we see inside.
Wow, that's really amazing. That's kind of like a real specialty. You know, the ability to do that minimally invasive procedure is really an expertise.
Correct. Yes, it takes special training. Actually, the first even time a urologist was successfully able to complete a laparoscopic surgery was in 1991, so not that long ago.
So not that long ago.
Yeah.
Wow. Yeah, you know, when we think about having surgery and having to cut somebody open and them having a long recovery time and all the pain, having a minimally invasive procedure really has some significant benefits. I mean, patients probably don't even have to stay in the hospital many days, right, now?
Definitely.
So, can they go home same day sometimes?
Sometimes, with not so much laparoscopic or robotic surgery, that usually requires for us at least one night stay in the hospital, which is a lot shorter than it was before. After major surgeries like prostatectomy, nephrectomy, where we remove the kidney, patients are going home after 1 or 2 days in the hospital.
Wow.
But there are same-day procedures for us, especially for urologists, and those mostly include kidney stones, so treatment of a kidney stone. Patients go home the same day with no incisions. And same for bladder, say bladder cancer or bladder tumors, doing things like that. Prostate, for enlarged prostate, removing some of that with a laser. That all patients can go home the same day.
Now, you talked a little bit about kidney stones. Tell us some of the ways that you can treat kidney stones. I mean, there's different, you know, I hear about lithotripsy and all these other procedures. So what do we do at the medical center, and what typically is your course for treating somebody with a kidney stone?
So typically, kidney stones, as you know, present with quite a bit of pain for the most part.
Usually in the emergency department, right? They're screaming in pain,
screaming in pain. And so what we do normally is there's a few options. It depends on how big the stone is, where it's located in the tract, and then also patient factors. So say if they're on blood thinners or if they're, there's an infection or something like that.
Oh, so not everybody goes to the OR and you just pound them with that lithotripsy and they all, there's different,
not everyone, yes, there's different criteria that decide who can get what treatment. Oftentimes the two most common options are the two that you described. Lithotripsy is also known as extracorporeal shockwave lithotripsy. That's a procedure that we can have the patient under sedation even, or completely asleep, and they just lie on a table, and shock waves or sound waves are transmitted through a machine, the lithotripsy machine, and it fragments a stone, and then the patient passes those stone pieces that are much smaller than the bigger one that they had. The other way, the laser lithotripsy, is where we go in with a tiny scope in through the urethra while the patient's asleep, and we target the stone with a laser, a holmium laser. Break up the stone into tiny pieces, and then we can use a very tiny basket to pull those fragments out and leave the patient stone free at the time.
Wow. Yeah. That's like high tech, like, you know,
that's part
with
of
a laser and all that. Is that why you decided to become a urologist?
Really? I decided to become a urologist is because all the neat instruments that we get to use.
And all these different procedures. It sounds like there's been such huge advancement in urology. I mean, even treating prostate cancer and things like that. There's been huge things that have happened, right? In different modalities that you can treat prostate cancer.
Oh, definitely. Yeah. I mean, there's some that are still being researched, and then there's the known ways of, you know, radiation for prostate cancer, surgery for prostate cancer, but also newer ways of, say, microwave therapy or minimally invasive therapies for prostate cancer, but also enlarged prostate.
Wow. Okay, great.
Yeah.
We're here with Dr. Shah. This is the Medical Center show, and we'll be back in a couple minutes.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Welcome back to the Medical Center Show. We're here with Dr. Shah, one of our brand new physicians on staff at the Jersey City Medical Center and part of our initiative to expand the urology services at the Medical Center. Dr. Shah's office is on the campus of Jersey City Medical Center, right across from the light rail in our new medical office building. So Dr. Shah, we were talking a little bit about prostate cancer and men with prostate cancer. So tell us about different treatment modalities. I hear there's all different ways that you can treat prostate cancer, and what are some of the considerations that men need to make in really figuring out what's best for them?
Right. So that's exactly right. Prostate cancer, we are taking more on an individual basis. It's not just every man at the age of 50 needs to be screened. There's been a lot of controversy in the media and in the literature about when somebody should get a PSA. Is PSA screening even necessary?
So tell us what PSA is.
PSA is prostate-specific antigen.
Okay.
It's a blood test that we do to help screen for prostate cancer.
I see.
Yeah.
So if it's elevated, that means I have cancer?
Not necessarily.
Okay.
So if it's elevated, that tells us that you are somebody that is more likely to be diagnosed with prostate cancer, and we should look at you more closely.
Okay.
And so what we do at that point is we would need to do a biopsy of the prostate to determine if you had cancer or not.
Okay.
Yeah.
And so what percentage of people with elevated PSAs, this prostate-specific antigen, which is a blood test, end up with cancer? Is there a specific number?
It's hard to pin it down. I believe it's somewhere around 20–23%.
Okay, so not everybody who's got an elevated PSA.
There's a lot of reasons that your PSA could be elevated.
Okay.
So an enlarged prostate could do it, an infection could do it, a lot of other reasons that your PSA could be elevated, but not necessarily from prostate cancer.
So one reason your prostate might get enlarged is because you have cancer, right? And then there's a certain amount of treatment for that. But you also talk about something called benign prostatic hypertrophy, which is just your prostate's big?
Yeah, your prostate gland enlarges, and all men's prostate glands enlarge as they get older.
Is that why we go to the bathroom so much
sometimes? You go to the bathroom so much.
I need to come see you.
And and that's a pretty normal part of aging, and it affects some men, and in some men it's not a problem.
Sure.
So yeah, it's very common though.
But let's talk we talked a little bit about prostate cancer and the different treatment options. Tell us a little bit about what the options are with a man who has.
Sure. So there's always an option to not do anything.
Okay.
Prostate cancer is a very slow growing, for the most part, low grade cancer.
Okay.
So most men can live about 10 to 15 years without having any treatment and still do okay.
Okay.
It just depends on the age of the patient, how active they are, and what their interest is in treating it.
Okay.
And if that patient is interested in treatment, then I definitely offer. The two biggest are radiation, so it's either external radiation or tiny seeds that are radioactive that can be implanted into the prostate and work over time to kill the cancer.
Oh, okay.
And then there's also surgery. So surgery to actually physically remove the prostate.
Okay.
And then so the bladder and the urethra back together.
Right.
And so that actually removes all of the cancer.
Now, are there different kinds of prostate cancer? So, like, one treatment might be better for a different kind, or how do you make the decision, like, which?
Right. So there are different grades of prostate cancer. There's something called a Gleason Score, which is how the cells look like under a microscope and how aggressive they look.
Right.
So those are all determining factors in what type of treatment your urologist would recommend that would be best for you.
So when you do seed implants, do you do that procedure?
I don't do that by myself. We work with radiation oncologists.
Oh, you do? Okay.
Yeah.
So you guys work together
and
you figure out
how many seeds, where they should be placed, all of that stuff.
All right. Good outcomes for most patients with prostate cancer?
Yes, definitely good outcomes. The main side effects of having treatment that most men will be affected by are their urination, so possibly incontinence or leakage of urine, and then also sexual dysfunction.
Okay.
So those are the two biggest side effects.
And there are ways that you can, now with the robots and this minimally invasive procedures, you can prevent a lot of that, right?
Prevent a lot of that, and also, if it does happen, treat a lot of it in minimally invasive ways.
All right. We talked a little bit about just the prostate just getting bigger because you're getting older. I don't know who suffers from that, but, there are some men that do that. How do you treat that?
Okay, great. So that's a great question. There are treatments such as medications, and then there's more invasive treatments such as surgeries or using lasers to remove some of the prostate tissue. You can even go as far as removing the entire prostate.
Oh, okay.
But the easiest thing that we usually start with is a medication. So 1 pill a day, and what it does is help relax that area.
Okay.
and it can help the stream get stronger, so you go to the restroom less. And then if that's not helping, there are other medications we can add to actually shrink the prostate. So they work in two different ways, but in conjunction with each other can have a maximal benefit for the patient.
Oh, okay, great. Yeah. And typically the medication works really well and patients are okay?
For the most part, yes.
Any side effects we have to worry about?
Side effects, a lot with something like an alpha blocker, which is something like Flomax, would be some dizziness or feeling a little bit weak, but for the most part, it's very well tolerated.
Yeah, so most of your patients who are on Flomax do pretty well.
Do pretty well.
Yeah, and are there other medications? There's other types of medications for that?
There's other types of medications. So besides the class of alpha blockers, there's 5-alpha reductase inhibitors, and those are the ones that actually shrink the prostate. They have some more side effects, sexual side effects, because they're blocking the active form of testosterone.
Okay. We talked about other things that might impact men from a urologist standpoint. What other things do you see in your office?
So prostate cancer and enlarged prostate are two of the biggest things that affect men, but sometimes even things like erectile dysfunction, chronic pelvic pain syndrome, or prostatitis, infection or inflammation of the prostate is very bothersome, but it's something that we treat.
That you treat in your office. So you see men in your office all the time. It's kind of a big part of your practice, I'm sure.
Oh, definitely. It's the main part of my practice.
It is.
It is, yeah, because urology is generally thought of as a male field, or problems that men have. But it also includes women as well. I would probably say 60% of my practice is men and 40% female.
Okay, great. And you have this great new office in our medical office building, and we're so happy to have you here.
Thank you.
We'll be back in a couple minutes where we're going to talk about women's health as it relates to Dr. Shah's practice and urology.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Hi, welcome back. Joe Scott with the Medical Center Show, and we're here with Dr. Shah, and we're talking a little bit about urology. Dr. Shah is a brand new urologist on staff at the Medical Center, and we're thrilled to have her.
Thank you.
Part of our team. We're talking a little bit about prostate cancer, and then we're going to talk about women's health issues as it relates to urology. But tell us a little bit about the ethnicity. Are there different populations that get prostate cancer more than others? You know,
definitely. So the African American population has around a 2 times more likely chance of getting prostate cancer.
Wow, I didn't realize
and
that.
Possibly should be screened. Also, a family history of prostate cancer makes you 2 to 3 times more likely to develop prostate cancer. So we generally tell patients that are in those categories that perhaps they should get their one PSA checked maybe at the age of 40, not the traditional 50 when you turn 50, and then if everything is okay, then they can at least have a baseline to check them against, because we may find it sooner in them.
So, if I am an African-American male or have a family history of prostate cancer, you really should get that screening. It's a simple blood test.
It's a simple blood test and an exam, a rectal exam.
An rectal exam, And the so really it's important that people get screened, because if we catch it early enough, right, most patients do very well with prostate cancer.
Oh, do very well, and it's curable. Yes.
Right, that's great. Okay, well, that's good information for our audience to know.
Yeah.
Okay, let's switch topics a little bit, and we're going to talk about the ladies. So tell us a little bit about some of the things that you encounter, and what are some of the issues that women deal with when it comes to urology.
Right. So women do have urologic problems. They have the organs that we treat, and so there are things that can go wrong with those organs. So the most common thing I see for females is incontinence. That's probably specific to females. Anyone can get bladder cancer, kidney stones, kidney cancer. All of those things are men and women we treat. But specific to women that I see a lot of is urinary incontinence, so leakage of urine. Say when they're coughing or sneezing, or they can't make it to the bathroom in time because the urge to go is too strong.
Wow. And does this happen in young women, old women, everybody?
It can happen in young and old women. Mostly older women, and the reason is the pelvic floor muscles relax as you get older.
Oh, I see.
And so that allows for leakage of urine. But also younger women around the time of childbirth, when they're pregnant or postpartum, can suffer from...
so after they have a baby, that could weaken the pelvic floor, and that causes these problems. And that doesn't necessarily resolve after a time after they've had the baby? So
sometimes it doesn't.
It does. It does resolve.
Sometimes it does, and then sometimes it can persist.
Okay, and so now we've got this situation where they have this weakened pelvic floor. How do you treat that?
Right, so I like to start with the least invasive to the most invasive. And so there are a lot of physical therapy type exercises they can do. There's something called biofeedback, which is actually training your bladder and your brain to work together, telling your brain to control the urges when you have the feeling that you need to go to the restroom, to hold on to the urine, to not leak. And those are all exercises that you can do that there's no side effects. There's nothing that can harm you. You don't lose anything if you try them, and if it works, that's great because...
Does that work even in older women?
Oh yeah, definitely.
Wow.
Yeah, especially older women, because a lot of times elderly don't like to take medications or have surgery. But those are two other options. So medications are another option. There's a large class of medications called Anticholinergics, and that helps with that urge to go. That those commercials, gotta go, gotta go. That's what it helps with, and it can help give you longer time between when you have to go to the bathroom, decrease those urges.
Are there side effects associated with those anticholinergics?
Yes, there are, and that's a big reason why some women can't, or some people can't take those medications is because of the side effects. Mostly dry mouth, dry eyes, constipation.
Yeah. Okay. I was a pharmacist, I remember the dry mouth part, but the rest of it I forgot. And then you said surgery might be another option, right?
That's true. So a lot of times we'll do surgery for stress incontinence. Stress incontinence is where when you cough and you sneeze, you leak. And we can put a sling in, which is like a hammock that goes underneath the urethra and gives it support. So when any of those acts that you do that increase your pressure in your belly happen, it gives it support so you don't leak. For urgency, that's a different type of incontinence, and we treat them two different ways. For urge incontinence, we can do something called InterStim. It's sacral neuromodulation, and we put in this tiny lead into this, the S3 nerve root, so into the back, and it sends a little impulse to the bladder and blocks the pathway that tells it it has to go right away.
Wow.
It's very neat.
And is it's minimally, you don't have to, it's not like a huge surgery, right?
It's not a huge surgery. You have a small incision in your back like this. I can do the trial in the office, actually. So if it doesn't work, we don't even proceed to surgery.
Oh, I see.
And you go home the same day.
Wow, there's like these huge advances, right, in how these patients are treated. I never even knew all that. That's great. Any other issues women have? What else do you see in the office sometimes when women come in that...
So prolapse is another big one. Prolapse, pelvic organ prolapse. Oftentimes after having hysterectomy or as they get older, same reason, the pelvic floor muscles weaken. And that's why the pelvic organs tend to sag. And so there are different options we have, non-surgical and surgical, a little bit more invasive because it's basically an anatomy problem. We have to fix the anatomy again. And so usually surgery is what's needed.
And there's no medication or anything else?
There's no medication. There are some gynecologists that'll do a pessary, which can help hold everything up. But that is sometimes uncomfortable and inconvenient, so younger females don't like that option.
How do women decide whether to go to a gynecologist or to a urologist? You know, isn't that
That's
confusing?
A great question.
You know,
it is confusing, and there's a lot of overlap. Because gynecologists are usually the first doctor that they see.
Sure.
And so they don't know. But any type of urinary problem, that's where our specialty is.
Right.
The bladder,
sure.
any type of leakage, the bladder prolapse,
right.
Anything like blood in the urine.
Right.
All of those things are reasons to come to a urologist.
Wow.
That you definitely need to be checked out.
Well,
yeah.
that's because I think that might get confusing for patients. You know, I'm not
right.
sure which doctor to go to.
Exactly.
Do you sometimes refer to the GYN?
Yes.
You do.
Yeah.
So if you
yeah.
have something that you believe is better treated by the GYN doctor, you refer them over. And I'm sure there's probably many that refer back to you
yes.
too.
Yeah.
So. And we have a great group of GYN doctors in our medical office building too, so it's real convenient. Probably right down the hall, right? They could be right there. Yeah. That would be great. Anything else women should know about urology and how to stay healthy?
Mm-hmm. Well, urology is definitely a field that affects women as
right.
well. So urinary tract infections is a big one that
right.
we didn't talk about
Absolutely.
yet. And keeping the health there, bladder health and kidney health.
Right.
So urinary tract infections, kidney stones, bladder cancer, all of those, kidney cancer, those all affect women too.
Right.
So it's not something to be ignored. I think the biggest reason that women would come is for incontinence problems, but then there are other reasons. Blood in the urine is a big one that anytime there's blood in the urine, whether it's a male or a female, it needs to be checked out.
That's a good point. So people, if they have blood in their urine, that's a sign that something could be terribly wrong, and they should
Definitely.
get that checked out right away.
Some of the main causes for blood in the urine could be something simple like an infection, but
right.
if ignored, it could get to become serious.
Right.
Cancer is always a concern, bladder cancer, kidney cancer,
right.
and stones also.
Wow.
Yeah.
Yeah, so so those are some of the markers. Any other markers like that people should say, I think it's time we go to the doctor? Any early warning signs that, from your perspective, that you would say, if I had that, I think I should go see my urologist?
Yeah, so blood in the urine is definitely a
right.
big one. Any change in your urination habits.
Oh, really?
So like you were saying, some men will notice, I'm getting up more at night,
right.
or my stream is getting slower. Or for women, I'm leaking more. Something's
right.
changed. That's always a concern if something's changed.
So big change in what your normal routine is.
Exactly.
You should really seek some help and get it done. Yeah. And Dr. Shah is in our medical office building, so it's very convenient for all you Jersey City folks to come to Jersey City Medical Center. We are thrilled to have Dr. Shah as a member of our staff. She has great training, as you can see. She brings the latest modalities in the treatment of urology to our medical center, and it's one of the areas that we really wanted to expand because we felt like there were a lot of patients who were seeking care outside of our county for urology. And so we're so glad that Dr. Shah has joined our staff, and we're thrilled to have you. If you need an appointment, please feel free to call Dr. Shah's office. She's conveniently located on the medical center campus, right across from the medical center. We'll be back next week with more topics on medical topics on the Medical Center Show.